profound, profound therapeutic potential of Varmam as non-invasive, cost-effective alternative to major surgery. Let's go through the case history, the intervention, and the remarkable clinical outcomes. Let me describe a brief background of the study. Dysphagia is the medical term for difficulty in swallowing. This case is a 49-year-old male who got progressive dysphagia throughout a 2-year history of his medicine. He initially had a little bit difficulty in drinking water, then it progressed into difficulty in both eating and pain. And in August 2025, he was presented with severe difficulty in swallowing. He was referred first for a general hospital in where he got the endoscopy, which revealed a gross esophageal dysfunction, and they required an esophageal replacement surgery, which cost around 4 million Sri Lankan rupees. Here on our clinic, based on Siddha principles, the condition was diagnosed as Sanguthiri Varmam in Varma therapy, which is attributed to a trauma-induced disruption of swallowing reflexes. In Siddha aspect of the issue, we have 3 major Shaktis in our body which promote to living. One is Prana Shakti, second one is Jiva Shakti, the third one is Kundalini Shakti. The Prana Shakti is gained through our respiration and it runs through nadis in our body. And when a nadi gets blocked, we call it the Varmam. So this Varmam is because of a traumatic injury to the Prana pathway, and the diagnosis on Siddha principles produced that this must be the Sangathiri Varma point. We decided to give an intervention exclusively with Varma therapy. First one is the Kutti Varmam or Sevikutti Varmam, which is present inside the ears of the patient. We inserted our index finger and the middle finger on inside both of his ears, and we rotated with half Matre pressure 3 times to the front, 3 times to the back, and 3 times to the front. Likewise, the Konde Kolli Varmam is at the crown of the skull on top of the head, which also we gave half Matre pressure. Then there is Kavala Varmam, which is on both sides of the face at the temporal region above both the ears. The Konasani Varmam is at the junction of ramus and the body of the mandible, which was given again a half Matre pressure. And Matriga Varmam is on the anterior side of the neck above the vocal cord, which also received a half Matre pressure. The Matre is the graded finger pressure we give during the Varma therapy. All these relevant Varma points were stimulated in a sequential manner during each session, a session twice a day for 4 consecutive days. As our observation, major changes occurred on 2nd and 4th days of the treatment. On the first day, he had difficulty in pain and inability to swallow, and gagging reflex when swallowing, had some regurgitation issues, and frequent heartburn and coughing while trying to eat. On the second day, the symptoms relieved by half, and on the 4th day, which was on 9th of August, the patient was able to drink and eat food without any uncomfortability. The discussion, therapeutically, Varmam is applied by manual stimulation, either by hands or palms, fingers, or an external blunt object, which might be a neem seed or tamarind seed. The matre is the intensity of the pressure we give. There is quarter, half, 3/4, and 1 matre levels. The half matre we chose to give is just a gentle pressure using fingertips without causing any pain and not very light too, right? So this matre is used on very light and gentle areas where the Varmam has to be applied. The nadis, as we told earlier, are the passageway for prana shakti to move through the body. There are 72,000 nadis present in our body, which all converge into 10 dashanadis. And the three first dashanadis are Sulamunai, which is on the middle, which can be compared to the spinal cord. The Yakkala is on the left, which can be compared to parasympathetic nerves. The one on the right side is Pinkala, which can be compared to sympathetic, but still we don't compare and give treatment on the western side. The Varmam points are closely related to the nadis because Varma is the blockage of prana shakti through the nadis, and there are 108 Varmam points in our body. In this case, the injury at the Sangutiri Varma point caused the patient to for dysphagia, which is the difficulty in swallowing. We induced and we gave Siddha Varma therapy by stimulating these points so that the blocked nadis can open and the prana shakti can move through. Thus, the patient was able to relieve the symptoms and the pranic balance was restored in his body. This case highlights the therapeutic potential of Varma therapy as non-invasive, safe, and cost-effective alternative to a major surgery which was prescribed to the patient in the hospital. They needed an esophageal transplantation, which cost around 40 lakhs. That's 4 million Sri Lankan rupees. But this treatment was completely done with just a mere 5,000 Sri Lankan rupees. And which, apart from that, the patient was never given an anesthesia and didn't have a prolonged hospitalization after the surgery. So the psychological effects are also present here. Contrast to Siddha medicine and Varma therapy provide a non-invasive, cost-effective treatment in managing such conditions where the prana shakti is blocked in the nadis, according to our Siddha principles. There are 108 vital Varma points in the human body. When these are stimulated skillfully, they can activate the nerve function, they can regulate the blood circulation and restore physiological balance without any surgical intervention. This surgery cost only 5,000 Sri Lankan rupees, which made it most affordable, and the patient relieved within just 4 days of treatment, which was very much we were impressed about the therapy. As a conclusion, this case demonstrates the potential effectiveness of Siddha Varma stimulation in treating severe esophageal dysfunction, offering a cost-effective and non-invasive alternative surgery. Further studies needs to be done here as case series or dependent tests where major populations are needed and recommended to validate these things, which is our future scope. We referred these articles, especially the Varmamaruthvathin Adipadagal, the fundamentals of Varma medicine by Kannan Rajaram sir, and the guidelines for practice of Siddha Varmam therapy by Dr. Ramaswamy. And we acknowledge the other authors and special gratitude to Herbal Healthcare Center workers for their valuable support and assistance during the therapy sessions. Thank you. Sure.
This dysphagia, you used any diagnostic criteria like only physical or medical history, or used any endoscopic like investigations, anything you used or not?
No, the patient came up with all these esophageal, these endoscopy results and stuff, but
Ah.
we clearly diagnosed with our Siddha principles only.
So patient don't have any endoscopic results, isn't it?
Sorry?
Patient whether have any endoscopic investigation. He
No.
done not.
After the treatment, we didn't do anything because he was perfectly fine and eating well. But before the treatment, he already came up with the diagnosis.
Okay. Because sometime maybe malignancy we have to exclude. No, that's why
Yes, yes.
Okay, thank you.
Oh, thank you, thank you.
Can you mention
Yes.
the follow-up period about
Follow-up period, we followed him after around 2 weeks from 9th of August, and he was perfectly fine and didn't have any pain, but still we gave him some oil massages on his neck area
okay.
as prophylaxis. Yeah.
Okay, thank you.
Thank you, thank you.